Hi everyone, we are today on episode number 7. I am your physiotherapist. We are here to discuss about tennis elbow, also known as lateral epicondylitis. In simple terms, it's tendonitis or inflammation of the tendon in your forearm. This tendon connects your elbow and it goes all the way through your wrist to your fingers. So let's discuss a little more about, the causes, the symptoms, how we diagnose it, and what would be the at-home first line of treatment that you can do. However, I'm going to share some of the exercises that you also can include in your rehab. You need to make sure that you discuss them with your physiotherapist before you start doing them. All right, so let's get started. So let's talk about the causes of tennis elbow. As I'm talking about them, you can see that there's a stretch routine or a warm-up going on in the video. It is done 3 to 5 times, both the sides, and each time it is held on for 20 to 30 seconds. All right. So basically, tennis elbow is a repetitive overuse injury. That means it happens over time. So for example, you are doing activities like raking, knitting, typing, tennis, right? These activities can cause an overuse inflammation in the tendon and sometimes microscopic tears in the tendon. So before we discuss more about the symptoms, you can get on with some strengthening. This is strengthening of the same tendon that is usually injured in tennis elbow. So we want to make sure we're starting to keep it strong and not lose the existing strength. However, do this exercise in pain-free range of motion, and I would love for you to do 3 sets of 10 reps, but that could be not a golden number for you, so you can stop when you feel fatigue. So the symptom wise, you would feel, of course, pain. You could feel the pain on the elbow itself, on the other side, or you could feel in the forearm, and sometimes you can feel it going all the way to your fingers. Now this is pain. Remember, it feels aching, okay? So when you lift something, when you're gripping something, you feel weakness, that can also tag along with this. Now in the next exercise, we are counteracting with the other set of muscles. So we want to make sure that the injured muscle has some friends helping them. So this is why you do this certain exercise. Again, 3 sets of 10 reps. Try to go as many times as you can before your failure point. Now, as I was saying, yes, you felt that there was some inflammation. Now, the red alert is that if you see it swollen or bruised, because that means that it's really injured in there. So you really need to see a doctor. And for the diagnosis part, when you come in to a physio clinic, they're gonna ask you questions for sure, but they're gonna do some special tests in order to confirm their diagnosis. And most of these tests are so specific and sensitive that we can trace which tendon is exactly injured. Okay, so we are on my favorite exercise. Now, this exercise is most of the times missed, but this is a very critical exercise for improving your tennis elbow. So as you can see in the video, he is lifting the weight from the bottom end and then just turning your hand in to out. Okay, you're doing the same thing. Try to do as many as you can until you feel fatigued. However, take breaks in between. It's very important. That's why we divide the repetitions into sets. So you can take a quick 10-second break in between. So to talk about treatment in general, when you see that, there is something wrong, my elbow hurts, it looks swollen, the first things first is your icing. You need to ice it. So take a frozen pea bag or your ice pack, wrap it in a towel, and then place it on your elbow. and you're going to place it for 15 minutes and try to do that a couple of times a day until you see your therapist. So you can see the exercise in this video. It's a grip strengthening exercise. He here is using a dynamometer, which is a very good measurement to know what is the grip strength. We're going to measure both the sides, and we're going to do the exercise of pressing and squeezing. You could choose a ball as well, but this gives me a good feedback. So what is the next step after icing in your treatment? Seeing your physiotherapist, right? So the sooner you go to your therapist, the sooner they can kickstart the treatment and they can get you out of it in a shorter span. They can use treatment methods like mobilization, manual therapy, hands-on treatment options. There could be laser therapy. They could also use some sports tape. And there's some who would use acupuncture. It could be used at different time of your rehab. So for example, if you came in acute stage, we are looking for less invasive treatment. Subacute and then chronic, you need to go a little more aggressive with the treatment because we don't want it to last forever and then give you a delayed treatment option like surgery or etc., which your doctor can tell you more about. So let's get started with a little bit of prevention as well. Okay, cool down. You can see that he is doing a couple of twist and turn movements. These movements are also important. These exercises are quite difficult. He is doing way advanced in the rehab. So this is done maybe for a minute and then you take a break and then you try again. However, not to overdo them. All right, so we're going to discuss a little more about preventing tennis elbow, right? Why not? It's so important. So, the first things first is keep your strength. So, that means you're making sure that your forearms are stronger, you're doing exercises for your forearms, stretching your forearms on and off, right? If you know that your activities are demanding, definitely strengthening and stretching should be part of your routine. For example, you're going to play tennis, just do some before you play tennis. There is other things that you could do to prevent it is ergonomics. So make sure that your workstation is in good shape. You are not straining your wrists, you are having your laptop, your mouse, everything well arranged, as we call ergonomically sound. And the last thing is that you're following and completing your rehab so that you do not re injure. All right, so that's it from me, guys. Please let me know if you have any questions. You can leave it in the comments and I can answer them for you. Again, thank you so much for being with me throughout this session. We're going to come with more education in the next episode. So please subscribe and like this video so I can keep going. And as always, talk to your therapist, get the right diagnosis, and make sure you're doing these exercises at the right time in your rehab. Take care till then. Bye, guys.